Good afternoon, everyone. We're going to go ahead and get started. My name is Julie Appel. I'm a senior program manager for the Catalyzing Communities project at the Friedman School of Nutrition Science and Policy, and I want to thank you so much for joining us at our third Catalyzing Communities Learning Collaborative keynote presentation. We are thrilled to have Dr. Alison Tovar presenting today. And before we dive in, just a couple housekeeping items. We'll have time to answer a few questions after Dr. Tovar's presentation, so please feel free to post your questions throughout using the Q&A button that you see on the bottom of your Zoom screen. The Q&A will be moderated by Ana Mops Rodriguez, a Stanley and Gershoff Diversity Scholar and doctoral candidate at the Friedman School studying nutrition interventions, communication, and behavior change. Ana worked as a nutritionist in Mexico City for several years before coming to Friedman, and her research focuses on effective communication strategies to promote dietary behavior change among Latinos. We will be recording today's presentation and we'll post it on our website as soon as possible. And at the end of the event, there will be a short Qualtrics survey posted in the chat that we hope you'll fill out to give us feedback on this event and help us plan future events. So thank you so much in advance for your time and feedback. And now it is my great pleasure to introduce Dr. Alison Tovar, an associate professor of behavioral and social sciences in the Department of Behavioral and Social Sciences and the Center for Health Promotion and Health Equity at the Brown University School of Public Health. Welcome, Alison. Alison is originally from Bogota, Colombia. She received her Bachelor of Science in Psychology from Northeastern University, a Master's in Public Health from the Tufts University School of Medicine, and her PhD from the Friedman School of Nutrition Science and Policy. She also worked as a postdoctoral fellow with Dr. Chris Economos, who's the principal investigator on the Catalyzing Communities project. Dr. Tovar was a faculty member in the Department of Nutrition and Food Sciences at the University of Rhode Island before moving to Brown University in January of this year. Her research focuses on understanding factors that shape eating behaviors early in life among diverse, underrepresented populations, and on developing community-based interventions among those populations. And I am lucky enough to have worked with Alison on the Catalyzing Communities Initiative and other projects at Child Obesity 180, and am honored that she shares her wisdom and knowledge as a member of the Catalyzing Communities Advisory Committee. So please join me in welcoming Dr. Alison Tovar. Take it away. Thank you so much, Alison.
Thank you so much, Julie, for that introduction. It's really a pleasure to be here today to talk about centering equity in early childhood to improve nutrition and food security among young children. While much of my research has been related to finding ways to improve healthy eating in young children, particularly in childcare settings, over the past 5 years, I've also had the opportunity to serve as one of the co-chairs of a national early childhood working group, which is funded through Robert Wood Johnson Foundation's Healthy Eating Research and NOPRIN, which is the Nutrition and Obesity Policy Research and Evaluation Network. I know that's a mouthful. But the goal of this group is really to convene a multidisciplinary network of practitioners, researchers, and advocates that focus on policy systems and environmental approaches to improve nutrition and promote healthy development in the places where young children live, learn, and play. And it is through this group that I've really had multiple opportunities to take a 30,000-foot view on some of the research and policy opportunities as they relate to equity in early childhood. And I hope to share some of those views with you today. So before I begin, I do want to start with my positionality statement. I am a Latina, heterosexual female researcher. I grew up in Bogota, Colombia, in an educated, bicultural, bilingual household with a US mother and a Colombian father. And my roots provided me with many privileges, including US citizenship, English language, and exposure to the US schooling system. My parents worked their way up the socioeconomic ladder and provided me with several opportunities, including comfortable housing, food, and healthcare. While my research is with early care and education providers and low-income Latino communities, and I may share language and certain cultural practices, I have never worked in a childcare setting, experienced poverty, hunger, or food insecurity, or what it's like to be an illegal immigrant in this country. So as many of you know, the prevalence of food insecurity in the US is high, with some really stark disparities. So households with children under the age of 6, single women with children, Black, non-Hispanic, and Hispanic households experience much higher rates of food insecurity compared to all households. We know that the roots of these inequities are quite complex, but we know that they do arise from structures of racism and discrimination and their myriad transgenerational, social, and economic impacts, and most recently really compounded by the COVID-19 pandemic, long-term food supply disruptions, and unprecedented inflation. We also know that in addition to not having access to adequate food, that young children's diet quality in this country is suboptimal. Children are not eating enough fruits, vegetables, whole grains, plant protein, seafood, and low-fat dairy. And on the flip side, are consuming too much juice, sugar-sweetened beverages, refined grains, and added sugars. National data from 2016 found that about half of US children and adolescents had diets of poor nutritional quality. So we know, and most of you know this, that a healthy diet on the flip side really helps us reduce the risk of chronic diseases, including obesity. We know that the first 5 years of life is so critical for development. So having a healthy diet during this time period really helps children grow and develop properly. We also know that food preferences are shaped early in life, and that early healthy eating habits also track into adolescence and adulthood, just highlighting the urgent need to shape these behaviors earlier in life. But these eating patterns, when I say these eating patterns, unhealthy dietary patterns, are starting early in life. This is nationwide data, which suggests that around 5% of young infants, 32% of 6 to 11-month-olds, still infants, and then 68% of 12 to 23 months old consume a less healthy snack on a typical day. While fruit and vegetable intake on a typical day is higher, they are still not meeting the recommendations for fruits and vegetables. And these trends just worsen as children get older. There are several scientific and expert consensus guidelines that have helped advance our collective understanding of best practices when it comes to what and how to feed young children. The most recent dietary guidelines for Americans now have a section on infants and toddlers, which is really exciting. Healthy eating research, which is funded through Robert Wood Johnson Foundation, has also put out 2 really great recommendations. The first is healthy eating guidelines for infants and toddlers, and the second one is healthy beverage recommendations for young children. Also, the last one here is Caring for Our Children, which was created by the National Resource Center for Health and Safety in Childcare and Early Education, which outlines standards for a multitude of topics in early childcare settings, including breastfeeding and nutrition. I'm going to be talking a little bit more about caring for our children in a minute. But together, these guidelines really help parents and caregivers understand important nutrition topics such as maintaining breastfeeding, providing opportunities for children to consume a diverse array of nutrient-dense foods, and engaging in feeding practices that allow children to communicate their hunger and fullness cues. So I'm not going to be spending time today talking about what and how caregivers should be feeding kids, but I'm happy to take some questions in the Q&A section. But how do we make sure that all children have access to nutritious, culturally appropriate food, and for caregivers who can feed young children in responsive ways? So to do that, I believe we really need to be thinking about changing the policies, the systems, and the environments that affect young children and their families, which really offers the greatest potential for sustained population-wide promotion of healthy eating and improvements in nutrition and health equity. I'm not going to read through the definitions but for those of you who are not as familiar with policy systems and environments, you can take a moment and look at some of those definitions here. But I suspect many of you are quite familiar with this term PSEs. And so why PSE? Why should we really be focusing on these wider approaches? When we focus on individual level changes, we often make changes in isolation of the context. It's usually time limited and in the end really relies on individuals' motivation and interest. These individual level changes often perpetuate inequities and doesn't really change the context by impacting everyone regardless of background and resources. These PSE changes, when implemented appropriately, can really be easier to sustain and again, doesn't rely on the individual to be motivated or interested. So over the past 2 decades, there has been extensive investment by federal, state, and local health organizations, as well as nonprofit entities in PSE changes to promote young children's healthy eating. One area which has a huge potential to impact young children's nutrition and food security is the early care and education setting, which is where I'm going to focus a lot of the talk today. So I recently had the opportunity to write this commentary with partners from CDC to document strategies at the federal, state, and local levels to support early care and education providers, use of early child nutrition feeding, and want to share some of what we put in that paper today. First, just to really point out that the early childcare and education setting directly influences young children's behaviors and can really have ripple effects. Out of the 21.1 million children aged birth to 5 in the US, about 59% are cared for outside the home at least 1 time per week. We'll be talking mostly today about formal childcare system, which includes pre-K, preschool programs, childcare centers, and care that is provided in the home called a family childcare or family childcare home. Center-based care is the most common, and children who attend, I will be calling it ECE just for short, spend on average about 30 hours per week. So again, centers is the most common form of early childcare. And it is about 31 hours per week that they spend there. I do want to note that in the US, the early childcare system is really complex, layered, and decentralized, with providers connected to information and resources through sometimes overlapping federal, state, and local programs. I will also add that the pandemic brought to light many issues with this system and the early childcare system. And as such, there's really been a renewed attention to support and strengthen this important setting. So at the federal level, I'm going to be talking about 2 programs that focus on nutrition and health in young children. The first, and many of you have probably heard about this program, is the Child and Adult Care Food Program. It's a federal program that provides reimbursements for nutritious meals and snacks to eligible children and adults who are enrolled for care at participating childcare centers, daycare homes, and adult daycare centers. It reimburses nutritious meals and snacks for about 4.2 million children in ECE programs each day. So eligible providers could be reimbursed about $8 to $11 per child per day. We know from many studies that participation in CACFP among ECE programs has been associated with the provision of more nutritious meals for children. And in 2017, the CACFP meal pattern requirements, so what they could be serving, was actually updated to include more fruits and vegetables, fewer solid fats and added sugars, and more whole grains. So this better aligned with the dietary guidelines. It had not been updated in a very long time. So this was really exciting. And so newer research after that 2017 mark suggests that soon after the rule changes, participating ECE centers served healthier foods and beverages. And recent evidence of directly observed meals in participating centers suggests that the rule changes may continue to have lasting impact on the healthiness of foods that are being served across these different ECE settings. So I wanted to share some important work that Childcare Aware of America and collaboration with Nemours Children's Health is doing with regards to CACFP. They are creating what they call story maps and use geographic information technology to visualize CACFP participation and highlight communities that could be considered for CACFP expansion. A story map combines both maps and text to help users interpret what they see. Each story map tells a unique story about access to childcare programs in the states they've worked with. And the story maps layer information about childcare provider location, participation in CACFP, food access, family poverty, and more. And so just to show you an example, this is a map of Louisiana, and that by overlaying the poverty data with a heat map of childcare programs not participating in CACFP, you can see these hotspots of programs working in areas where families are eligible for assistance. So again, just highlighting that these are areas that most licensed childcare programs are not participating in CACFP, which I think is really helpful. So despite its advantages, CACFP is not used by many eligible childcare providers, leaving young at-risk children without CACFP benefits. Research to understand the extent of CACFP underuse and gaps in coverage is just beginning to emerge. And there are multiple potential reasons why CACFP does not reach many eligible programs in children. But Tatiana Andreeva, who's in UConn, from part of the Rudd Center, has done a lot of work in this space. And in one study, more than half of 256 licensed non-CACFP centers didn't know anything about CACFP, even though many were eligible. A more recent study, which aimed to identify facilitators and barriers to CACFP participation to expand CACFP reach and improve the nutrition of young children, found that many providers, they found that the requirements and the program paperwork was just too burdensome, particularly collecting income eligibility forms from families. They also found that among non-participating centers, there was lack of information and limited knowledge about the federal food program for ECE providers, which is an avoidable barrier in expanding CACFP. Finally, they found that one of the main predictors of CACFP participation in the sample was a center's nonprofit status, suggesting that a particularly large gap in coverage is likely among for-profit centers. So there's a clear need for efforts to increase participation and retention in this program. In Connecticut alone, $30.7 million were foregone in federal funding, suggesting that 20,300 children from low-income areas missed out on nutritious CACFP subsidized food. So CACFP is the first sort of federal program that I wanted to discuss, and then wanted to move on to the role of CDC. Through their division of nutrition, physical activity, and obesity, they provide funding directly to states to help improve early care and education policies, practices, and environments. To shape their work, the CDC has created what they call their Spectrum of Opportunities framework for obesity prevention in early child care education. This framework helps state agencies and their ECE partners consider 9 policy system levers to improve the nutrition and physical activity and breastfeeding environments in ECE facilities. CDC is currently providing funding and technical assistance to 32 states to use this spectrum as a blueprint to advance their work. As you can see, one of the layers, which we've already talked about here, is the Child and Adult Care Food Program. But 2 state lever examples that I'm going to share with you today include ECE licensing regulations and improving quality rating and improvement systems. So states are responsible for licensing childcare programs within their jurisdiction to ensure that they meet minimum health and safety requirements for operation. The licensing system offers built-in feedback loops in the form of routine monitoring, which holds ECE providers accountable for meeting requirements to legally operate. Most states open their regulation for revision about every 3 to 5 years, although this can certainly vary greatly by state. And in the last decade in particular, some states have adopted licensing requirements that go beyond the traditional health and safety rules to include health promoting standards, such as brain development, emotional well-being, but of course, things that we're talking about here today, healthy eating, and even physical activity. So states can require the licensing to include following CACFP standards, for example. So coming back to the caring for our children standards, this comprises of national standards that represent sort of the gold standard in high quality health and safety policies and practices for these ECE programs. Leading child and public health organizations endorse these standards, such as the American Academy of Pediatrics, the American Public Health Association, among others. And these standards were further refined by the National Resource Center for Health and Safety and identified those that were the most likely to prevent childhood obesity when included with licensing regulations. Through a consensus panel, 47 high impact standards emerged, which were organized into these 4 categories: infant feeding standards, nutrition standards, physical activity standards, and screen time standards. So a recent study, which published by folks at CDC, they examined these national trends from 2010 to 2018 and the uptake of these standards of childcare regulations. And what they found was that from 2010 to 2018, 39 states updated their licensing standards to include more breastfeeding and infant feeding, nutrition, and physical activity support. As you can see from the maps, one from 2010, where most states had about 0 to 20% of standards fully included in their state licensing regulations in the light green, to 2018, where most states now have anywhere from 21 to 41% of standards that are fully included in their state licensing regulations. So this is a good thing. We're starting to include some of these standards in the regulations. So furthermore, 23 states require ECs to follow CACFP meal patterns in licensing regardless of participation. So just to share an example of what these standards look like, this is related to breastfeeding and infant feeding standards. The first here is encourage and support breastfeeding and feeding of breast milk by arranging for mothers to feed their children comfortably on site. So in 2010, only 8 states had included that standard in their licensing regulations. In 2018, you have 11 states. Another example is introduce breastfed infants gradually to iron fortified foods, no sooner than 4 months of age, but preferably around 6 months to complement the human milk. Again, in 2010, 2 states had that in their licensing regulations. In 2018, 30. And just one more example here, serving no more than 4 to 6 ounces of juice per day for children 1 to 6 years of age. Again, 1 state in 2010, and now we can see that in 2018, 32 states had that included in their licensing regulations. And you can also see that this aligns with the CACFP meal pattern. Most recently in 2021, the National Resource Center screened more than 56 revised regulatory documents, and they created a score with 100, meaning that the state licensing regulations supports all high impact obesity prevention standards, with 0 not supporting any of them. So this is, you can go to this website, they have a really lovely report. But you can see here that Texas, Washington, Tennessee are really up there, where they are including a lot of this, these standards into their licensing, which is really exciting. So another way to leverage and support early childhood nutrition feeding in ECE is through what we call the QRIS system, so the State Quality Rating and Improvement System. So QRISs systematically assess, improve, and communicate the level of quality of ECE programs. In 2015, 38 states operated statewide QRISs, and 27 of these systems included obesity prevention standards. Just to show that in a map, and I do want to do a shout out to Carrie Doima, who I was able to write that paper with from the CDC, who let me use some of her slides. So just so you can see here, this map of 2020, while there are still several states that do not have statewide QRAS systems, so those are the white ones, the darker blue it gets, the higher number of obesity prevention standards have been included into the QRAS standards. Well, some of these federal and state levers I've talked about are great ways to leverage getting these standards into early care and education. The policies of individual ECE programs also play an important role in shaping childcare providers' day-to-day practices and create environments that are supportive of these standards. There's an evidence-based intervention entitled Knapsack, or more recently called Go Knapsack, that has shown to improve these ECE environments. It was originally developed in 2002 and offers structured process to help childcare programs improve healthy eating and physical activity practices. It's implemented with the help of a local technical assistants who support childcare programs through a 5-step improvement process. So it's self-assessment, then there's action planning, education, technical assistance, and reassessment. And so Knapsack, there have been many studies confirming its impact on nutrition and physical activity. So just as an example, again, if you go to their website, this is what a self-assessment looks like. And you'll see this is similar to some of those standards that we're looking at. So teachers and staff promote breastfeeding and support mothers who provide breast milk for their infants. And again, the provider is sort of checking off these boxes and self-assessing in these different areas. So in 2014, Knapsack was adapted into an online format, reducing the time required of technical assistance from 25 hours per center to about 5 hours. And so it's now entitled Go Knapsack. And again, really shown to produce similar improvements in practices. So as you can see from this slide, as an evidence-based intervention, Go Knapsacks has been part of the integration across all 9 suggested opportunities within that CDC framework, which I shared before. So for example, several states have linked Go Knapsack to their QRAS system, with 3 states formally requiring nutrition and or physical activity self-assessments. With regards to licensing, Go Knapsack best practices have been aligned to licensing and administrative regulations in multiple states, with 4 states actively promoting Go Knapsack as a way to help meet the nutrition licensing standards. Similarly, with CACFP, Go Knapsack complements CACFP. Some CACFP sponsoring organizations have trained staff as Go Knapsack consultants, using the resources to help childcare programs reach higher nutrition standards. So Knapsack, there have been sort of newer studies. There's the Choices studies, which are led by Erica Kenny at Harvard, again, just showing that this is a most cost-effective early childhood intervention, and really seeing this somewhat as a success, implementation success story. So right now, 22 states are using Go Knapsack. And it took between 5 and 11 months from contracting to enrolling ECE program based on partners' readiness. So while early care and education settings are a critical place to reach young children, there are many other PSEs that impact young children. Some in more direct ways, such as WIC, which we know is such a critical program, and healthcare settings, while others impact young children in more indirect ways, such as public housing or child tax credits. While I don't have the time to talk about all of these, I wanted to spend the last couple of minutes really discussing some of the ongoing challenges that I think we see with several of these PSE approaches. So the first challenge that I wanted to touch on is that of cross-sector and discipline engagement. So PSEs that are directly focused on food and nutrition sometimes don't even talk to each other. So the example I was going to share here, we know how important WIC is. We know how important early childcare education settings are. We know how important healthcare is, but yet we often continue to work in silos in these different settings, and I'm happy to share some more examples during the Q&A. The second area here are nutrition and food security PSE work that's being done without attention to impacts on family systems and young children. So just as an example, we know, for example, sugars, soda taxes are passing in many different states, menu labeling, but we don't think about what the impacts on young children are when we are passing some of these legislation. So I think that's really important to understand. And then few are assessing the impacts of PSE changes that are not specifically about nutrition, but that impact families with young children. So we know how important some of these are: parental leave, universal childcare, stimulus checks, and the child tax credit. So I think the child tax credit example is really a great one to show how one policy can really have a profound impact on other outcomes of interest. As we all know, President Biden and Congress enacted the temporary expansion of the child tax credit in 2021 through the American Rescue Plan, which made the credit more generous. And we saw that child poverty fell to the lowest rate ever recorded in 2021 at 5.2%. But we also saw that in the month and a half after the federal government began issuing monthly payments of the expanded tax credit, the number of adults living with children reporting that their household didn't have enough to eat fell by 3.3 million, or nearly 1/3. We also saw that the payments that they got were being used for food. So again, just a great example of how we can be looking at the impacts of these broader policies on families with young children. The second challenge I wanted to bring up is that of lack of attention to lived expertise. The recipients of policy systems and environmental changes are sometimes consulted, and even when I think about research that's done in this space, we often consult, and many times that's during the planning and or evaluation stages, but there are few mechanisms for providing meaningful insight throughout implementation. Policymakers and others are in charge rarely have personally experienced food insecurity or lack of healthy food access, and think it's really, really critical that these voices are at the forefront. The last problem that I'm just going to bring up is something that I've heard multiple times from Heidi Blank at CDC, and she calls it the tracks and trains problem. That our systems and approaches for developing and evaluating evidence-based PSE changes are on different tracks than the tracks that provide resources to families, and that many build train cars that can't be fully implemented, that it's sort of not getting on the right tracks or sending it off on the incorrect track. That we really should be thinking about, okay, where do the tracks lead to families? We need to be thinking about these sort of trains going on the right tracks. So that just really stuck with me for several years when she talks about that. So finally, I wanted to end with Dr. Shiriki Kuminikia's equity framework, which argues that in order to improve options for healthy eating and physical activity, they really need to be linked to strategies that account for or directly address the social determinants of health. The different PSE approaches that I discussed today can be embedded within each of these frameworks. For example, through early care and education settings, we can reach a larger number of young children, and we can ensure that standards are embedded within other early care and education systems, such as QRIS and licensing. We can also make sure that nutrition assistance programs are reaching these young children, such as in CACFP. We can also make sure that through these different systems and programs that we are empowering communities, in particular providers and staff within the early care and education settings, to really promote healthy behaviors. And I just want to add here in the middle, sort of talking about some of the challenges that I was talking about. I think these are thinking about some additional solutions, such as diversifying leadership, prioritizing users' experiences, and creating systems for input and feedback from those users with lived experiences. The critical need for cross collaborations and strategic partnerships, and just really creating trains for the right tracks. So I will end on a positive note, in that with the recent White House Conference on Hunger, Nutrition, and Health CACFP, for example, is integrated into several priorities through the strategy and will play an important role in ending hunger. In addition, Pillar 1 of the national strategy has a lot to say about the intersection of childcare and nutrition, and emphasizes the investment in affordable, high-quality childcare as a critical priority. Finally, within one of their pillars, they discuss the need to streamline requirements of participating in federal nutrition programs such as CACFP, so really helping to reduce some of those barriers. So with that, I'm sure there are some questions. I see the chat going, so I will stop sharing my screen perhaps and make sure we have enough time for questions. Okay.
Thank you very much, Alison, for this fantastic and informative presentation. It really helped us recognize and reflect on the challenges and the complexity around food security for young children, and also the work that is being done to improve it. So we do have some questions. Someone in the audience is asking, what opportunities or best practices have state agencies, staff, or other partners implemented to promote outreach in CACFP to increase participation?
Yeah, that's a great question. And interestingly, so during the pandemic, as many of you are aware, there were so many challenges. And we had an opportunity to talk to several directors, CACFP directors, and across different states to learn about ways that they were reaching out to their childcare centers and providers. And I'll get to the full question in a minute, but one of the pieces that we learned is just the importance of partnerships with different community organizations, partnerships across different federal programs. And again, I think with COVID, we just saw many people coming together and figuring out a way to work together to, of course, in this case, making sure that we're getting the food to children. I think it's an ongoing challenge to figure out what can states be doing to increase CACFP participation, at least in my state in Rhode Island. I know there's just a shortage of staff, for example, that cannot do additional outreach to help educate. I'm hoping that states could be doing more outreach and really educating these providers and participants that this is a good thing to participate. Having said that, I think there are a lot of barriers that I'm hoping in the next few years, we'll start to see, for example, technology. How can we have less paperwork for providers? I know so many, that's something I continue to hear, that it's just so much work to participate, that how can we really reduce the barriers? But I think, as you saw in that study, there is a need to just promote the program. I think many times people don't know about it. Regulation. Yeah.
Thank you for that. So going along the same lines of outreach, we're getting a question from Chris Lott that says, my program works with food equity and nutrition for underserved groups. What are some ways you can guide us to get more outreach to the community and get more engagement from the community? Currently, we do a lot of cooking demonstrations and trying to start community gardens in those underserved areas.
It sounds like she's doing all some wonderful things. So ways to engage the community in outreach. So I'm gonna say that I think the farm to early childcare, those are really some exciting avenues that we're seeing more investment in federally and nationally, and it sounds like they've started to do some programming there. I would say that's a tough one. I think meeting people where they're at, as we know, parents, in part of the equity framework that I think is so important to keep in mind, right, is some of these families and parents have so much on their plate and they're really struggling to make ends meet, and we sort of continue to add many things to their plate. And so thinking about meeting them where they're at. One project that I can share that we're thinking of, so I've done a lot of work with family childcare homes, and many times the family childcare home providers are really frustrated with parents. And again, this is sort of anecdotal and from some of the focus groups we've done. And we're thinking about ways that these providers can, again, sort of meet parents where they're at, and without having to add additional work to providers. And that's sort of the second piece that I'll add is, I think we have to be careful with how much we're continuing to give to providers to do. We know that they are overworked, that they have a lot of stress, that their jobs are paid, minimum wage. And so I think thinking about in the background policies that can help elevate some of these issues is important while doing some of the on the ground work. But other ideas might be things like reaching out to their SNAP Ed. I don't know, in different states, I know that varies, but they also have so much programming in the community, thinking about other community-based organizations that are already doing some important work. So as not to reinvent the wheel. I know I'm in a tiny state, so sometimes that's easier. But again, I feel like sometimes we continue to work in these silos, and thinking about ways that we can come together and share resources, I think could be important.
Yeah, collaboration seems the key. Thank you. So we also have another question from Daniel Schultz. He asks, thank you for mentioning the impact of the child tax credit and the benefit it has on nutrition insecurity. Do you feel other federal financial policies, such as baby bonds, policy in which every child receives a publicly funded trust fund account, could also make this impact? And what other financial policy interventions do you feel we could enact to make a difference?
That's a great question, and I'm gonna say that I am not an expert in this area, and so I think my understanding is that sort of financial policies. There's been many sort of pilot studies done and really shown the impact it can have on people's lives, and giving them space and opportunities to, find a job and take that additional time and money to fix their car and bring them out of poverty. I'm not as familiar with the other pieces, so I'm happy to look into it and get back to you, Daniel.
Thank you. So in your talk, you also mentioned that the pandemic had shown some issues around this, and Mary also has a question around this. So what have been the biggest impacts from COVID-19 on the ECE settings, and especially on the workforce, for example, childcare providers?
Yeah, so we know, first of all, that there were lots of closures. So many childcares provide childcare centers and family childcare homes just couldn't stay afloat. And so we know that first and foremost, that was a big issue. And then I think during the pandemic, we also saw how, again, in terms of like CACFP, that it was hard to actually get the food to kids. So unlike the National School Lunch Program, where schools had the sort of infrastructure to be able to get food to large numbers of families, CACFP was a little bit different. And so it was kind of piecemeal in terms of like figuring out, and many states were so creative and of course were able to use like bus routes, but many childcare providers don't actually prepare a lot of the foods themselves. Many of them use vendors, and so that was sort of an additional layer. I think family childcare homes have even more challenges. So they're smaller, they take care of multiple children of different ages. And again, sort of the COVID-19 restrictions and everything that entailed just really put a lot of pressure on this system.
Definitely, thank you. So another question, we've been using the term early care and education settings, and you mentioned that it's used to encompass several types of childcare. Are there some differences across these setting types that could be important to think about when leveraging some of these policies, systems, and environment strategies?
Yeah, absolutely. So I just alluded to a little bit. The differences in sort of family childcare homes are just so different. So these, we have centers, right, which are sort of the most typical type of setting, and centers typically divide children into different groups based on age, whereas a family childcare home takes care of children of varied ages. So they have to arrange meals and activities that accommodate children at these different developmental stages. So you can imagine having, you know, an infant and then also having a toddler at the same time. And so family childcare homes tend to have less structured schedules and operate with different logistical and space constraints than centers. And then family childcare homes sometimes have different regulatory standards for nutrition and physical activity, and also could feel more isolated with regards to training and resources and technical assistance. So again, they are a very different type. I mean, and many families actually prefer a family childcare home to a center. It is, you know, it feels like a home. You're leaving your infant with someone you really care for, but again, logistically has a lot of additional challenges. Here in Rhode Island, a lot of our family childcare home providers are Latina. And some of the studies we've seen, they actually they're able to prepare some amazing meals and serve some really culturally appropriate food to the kids that they're working with. And one of the things that we hear that is more of a barrier is really around physical activity. And just again, if you can imagine someone's home and thinking about lots of young kids jumping around, that certainly becomes harder for them. So those are some of those differences.
Yeah, thank you for that. So you also mentioned the role that lived expertise has. I was wondering, now that you're mentioning like these Latino caregivers that have like these culturally foods available, like are there some thoughts or some efforts in how to incorporate this lived expertise, maybe more systemically?
Yeah, thank you for that question, Anna. So I will share an experience of a study that I'm currently collaborating on with Dr. Kate Bauer. She's at Michigan. And what we do, it's not childcare providers, but I think this can certainly be used in the childcare provider setting, is we have parent leader boards. So we have groups of, right now it's 8 to 10 parents in English and 8 to 10 parents in Spanish. And this project is around food security or food insecurity and really learning about their own experiences in the COVID-19 pandemic and the response of federal nutrition programs. And they are really the drivers of so much of this project. So they, every sort of step along the way, have been involved in helping us develop materials. We're doing a survey which just got launched, again, asking families about their experience around food insecurity during the COVID-19 pandemic. And they really helped develop the survey. We were again, helped come up with the questions. We tested with them. And just some of the questions, us researchers that sit in an office, things that we really don't think about. and I know this may be obvious, but things like discrimination around different programs, and we didn't have a question on discrimination, and that was just really critical, especially to our Latino group. So I really think it's so important, and in the work that I've done in childcare, have sometimes had community-based organizations representing childcares, but never really had too many providers at the table. And just think it's, again, we've done the focus groups with them, gotten their input, but I think it's different to really have those childcare providers or directors, depending on center, at the table sort of every step along the way as we're developing our research or, you know, our community outreach, whatever it is. They have a very unique experience because they're obviously living it day to day, and I think we would miss a lot if we didn't do that.
Yeah, absolutely. Yeah. Thank you for sharing that. And do you have other thoughts about ways in which we can better engage with childcare teachers, staff, and directors to promote this type of work that you're sharing now?
So I think, yeah, I mean, obviously, I think we should all be at the core helping to move policies and legislations that can improve like minimum wage for these workers. And I think with that platform, then engaging them around other programs like knapsack, for example, or helping them around thinking about some of the standards. I think many providers and staff are they care about the kids' health. They really are motivated to make some of those changes. So I think certainly having, you know, a session where even, you know, telling them about some of these programs. Again, some states already have like knapsack training. There are, it's called Better Kids Care. It's a platform for trainings that are freely available to childcare providers. And I'm happy to share all the different resources. But certainly think that engaging them first in the conversation, I think would be my first sort of step, instead of sort of telling them that this is something that they're going to need to do. I think hearing about what some of their priorities are, what they're already doing. Here in Rhode Island, we're trying to pass farm to early childcare. And I think many providers are already doing so much in the classroom. They're building gardens, they're doing different curriculum. So on the ground, there's probably a lot happening. And so I think just having an initial conversation, and then instead of reinventing the wheel, there's already so many resources and curriculums out there that then if they're interested, then certainly using some of what's already there. And again, happy to share several resources that are out there with folks.
Thank you. One question that I had was, at some point you mentioned the difference between participation and retention. So I'm wondering if you have some thoughts about, like, on one side, we know that some of the resources are underutilized, but I'm wondering about the retention part. Like, are there some reasons why people go into these programs and then leave? And do you have some thoughts around that?
Yeah, and I'm assuming you're referring to like CACFP, for example. Yeah, I think there's just sort of ongoing paperwork and just ongoing, again, and there's not too much research on this, but a lot of the work, as I said, from Tatiana Andreeva, just shows us that the administrative burden is just very large. And so sort of to continue to maintain that, even though maybe at the beginning they had some initial support, but then, you know, sort of they lost that support. And so I think that is one of the big ones. Yeah, but I can certainly look in to see what other current retention barriers there are, but that's really the main one that's coming up in the literature.
Makes sense. Thank you. And I am getting a warning that we are running out of time. Julie, I don't know if there are some like housekeeping things.
Yeah, so thank you again, Allison, for your wonderful presentation, and Anna for leading that amazing Q&A, and to all the attendees for joining today. We really appreciate it. Katrina has just a quick survey to post in the chat. If you have 1 minute to take it, we would appreciate any and all feedback. I hope everyone has a great afternoon. Thank you again to Allison and Anna, and we hope to see you at our next Catalyzing Communities Learning Collaborative keynote. Thank you so much for coming. Have a great afternoon.
Thank you.
Take care.